edsvideo.com. Thank you.
Hello everybody, Dr. Carlo here, emergency physician. This video I want to show you an example of probably one of the worst case of jaundice or ictericia I've been encountered in my career. This patient was as yellow as my undershirt right here. Patient has non-alcoholic steatohepatitis, and that means it's not related to alcohol use or drug or IVs use. It's a medical disorder that causes liver failure. The patient actually, during the ER evaluation, showed a high creatinine, which is low renal function, low platelets. He has a rash over the lower extremity, which in the video you'll see my discussion with a family member about. Me think it's more of vasculitis rather than cellulitis of the lower extremity. This happens because of the low platelets and the bleeding that happens on the surface of the skin creates petechia rash, which is non-blanching rash when you push on the skin. You can see the ictericia very, very yellow. When you're looking at kids and you're evaluating for neonatal jaundice, one of the first places under the tongue, then you see the eyes and the skin, usually in between the folds on the hand. This patient was as yellow, like I said, as my undershirt. So the bilirubin was extremely high. This particular patient had a bilirubin of 29. His ammonia was very high. His renal function was acutely decompensated, which means he had hepatorenal syndrome, which I can make a whole video on that at another time. But just as a clinical picture of what it looks like so you know what to recognize. I hope you enjoyed this video, and many thanks to the patient for allowing us to share this with you all. Bye.
So I guess you were told initially that this looked more like cellulitis and they started some antibiotics. To me, it doesn't look like cellulitis. It actually is a petechial rash. Petechia means little bleeding underneath the skin. Okay. And I know that because when I press on it, it doesn't go away. Rashes that are cellulitis, when you touch them, they turn white a little bit, and then they come back and become red. So this is blood underneath the skin, and in his case, because the liver's not making any coagulation factors, his platelets are way low, so that's making him bleed underneath the skin and everything. And then of course you see all the yellow is from the jaundice and ictericia. I just want to show back here. You can see the color of the yellowness here. And look for us up again. You open your eyes for me again. So right there you can see all that yellowness and everything. And this is white here, and you can see how yellow that is. One of the first places you see ictericia is actually underneath the tongue.
Oh, really?
Then you see them on the eyes, and then on the skin and everywhere else. So that's a very extreme case of it.
Hey everybody, don't forget to check out my new iPhone, iPad app, Doc Oller, Doc Oller for short. Bye.
This skin disease will completely change your appearance. It's Stevens-Johnson syndrome, and it affects over 6 million people every year. Today's topic was requested by Clockwork69. If you have any other topics you'd like to learn about, be sure to subscribe and write your suggestions in the comment section below. Stevens-Johnson syndrome, or SJS, is a rare life-threatening condition in which your skin cells die, forcing the epidermis, or outermost layers of skin, to separate from the dermis, your layer of skin sandwiched in between your epidermis and subcutaneous tissue. It's a milder form of toxic epidermal necrolysis, which means it's usually caused by a reaction to drugs. Stevens-Johnson syndrome can be found everywhere throughout the world since it's caused by either genetic factors or drug-induced disorders of the immune system. About a quarter to half of SJS cases are due to unknown causes. The main cause of SJS is adverse effects from antibiotic use, particularly sulfa drugs. It can also appear in those affected by herpes, pneumonia, HIV, and hepatitis. Initial symptoms include a sore throat, fever, and fatigue. These are oftentimes misdiagnosed and treated with antibiotics. The antibiotics then cause ulcers and other lesions to appear in your mucous membranes, such as your mouth, lips, and genital and anal regions. Conjunctivitis of the eyes may also occur. Rashes of painful, round lesions then begin to arise throughout your body as the death of your skin cells causes a separation of your epidermis from your dermis. This triggers an inflammatory process in which the condition spirals downwards until the point of death. Stevens-Johnson syndrome is considered a dermatological emergency and therefore requires immediate hospitalization, often in a burn unit or intensive care unit. The first and by far most important step is to discontinue any meds that may cause this condition. Treatment is similar to that of burn victims. Supportive and symptomatic care is then required, which includes intravenous fluids and feeding, as well as administering analgesic mouth rinse for the mouth ulcers. The mortality rate for SJS can be as high as 40%, but with the immediate and proper treatment, it can be reduced to as low as 5%. Now, what do you think is worse and why? Being attacked by an elephant or being attacked by a rhino?